It's a lack of education. Someone says that they have pain, especially during sex, and most people, number one, don't know how to talk about sex. And then number two, don't know what to do with that information or how to treat it. They dismiss it, they get uncomfortable, they don't ask the right questions, and it leaves the client feeling incredibly invalidated and not seen. There's a lot more movement, I think, nowadays in talking about pelvic floor pain, and I'm seeing it a lot more just in general, social media, community, and the research. And I think it's really important that practitioners, therapists, counselors, psychologists know how to, number one, talk about it with their clients if it's brought into the room, and then also how to support them in a meaningful way so that they're getting the best care they possibly can.
Yeah. Oh, that's going to be so good. So I know pelvic floor pain is kind of a general term. So like
Mhm.
some specific concerns that you see in your practice.
Yeah, pelvic floor pain is very general. It's very broad. And I would say the most common that I tend to see in my practice is folks who experience pain during penetrative experiences. Um, you can have pelvic floor pain without any form of provocation, but for a lot of folks, I would say that's the most common is when it's provoked or when there's some sort of penetration occurring that's causing that pelvic pain. But not always. Some folks do live with pelvic pain that is unprovoked and they experience it, walking or sitting or doing any sort of day-to-day activity. So I see those folks as well, but most common is provoked pain.
Yeah, yeah. And so we don't want to give it all away here, but what's one like tip or piece of advice you have for other professionals if someone comes into their office and says, "Hey, I am experiencing pain with penetration." Like, what is their first step? What should they do?
They should validate it in a way that is meaningful. I think on average, at least in the Canadian research, most of my clients and most pelvic pain clients see anywhere between 3 to 5 professionals before someone believes them, takes their pain seriously, or offers any sort of meaningful diagnosis or treatment. And I've had clients who've seen upwards of 10 professionals, so yeah, it's crazy. And
Before you watch the rest of our video, did you know a lot of people haven't subscribed to our channel yet? So if you love this type of content, go ahead and click subscribe now before you watch the rest of the video.
so to me, the most important step is believing your client when they tell you that that's what they're experiencing and validating it, letting them know that, hey, like that pain is not, it's not normal, but it is really common. And I believe you because so many of my clients come in and I'm the first person to tell them that, which is sad if they've been through 10 professionals.
Oh my gosh. Yeah. I mean, that is so disappointing, but also not surprising. So, why do you think that is? Why do you think someone has to see 5 to 10 professionals before someone will finally validate their feelings or their experience? It's not even more their feelings, it's what they're actually feeling, they're in their body physically.
Yeah, it's nuts. I think number one, it comes down to a lack of um, education on the part of providers. It's a lack of education. Someone says that they have pain, especially during sex, and most people, number one, don't know how to talk about sex. And then number two, don't know what to do with that information or how to treat it. So they dismiss it, they get uncomfortable, they don't ask the right questions, and it leaves the client feeling incredibly invalidated and not seen, right? So I think there's a lack of education, and I think there's a lack of communication about these issues in general, right? It's not something that you're going to see necessarily on, the monthly collaborative meeting or the consultation group, the group of doctors, this isn't something that they're maybe necessarily going to know to put on their docket to explore. Because while it's incredibly common, it's also not something that a lot of folks maybe know how to talk about or know how to bring up to their providers. So then once they do, everyone's maybe kind of deer in headlights and like, whoa, what do we do now?
Right, right. And I mean, I read this study recently. What did it say? I don't want to say it wrong, so don't exactly quote me, but I think it was about 40% of people feel like shame, embarrassment, talking to their medical professional provider about any kind of related issues, sexual pain, sexual discomfort. And that's talking to a medical provider. So it's like, wow. I think
Yeah,
we have a lot of education to do just to empower people, to empower each
mhm.
other, and also to empower our medical professionals to be asking the right questions and helping people.
Totally. And that's part of my talk at the conference is what are the right questions? Because there are right questions and there are wrong questions. And so what are those right questions and how do we help clients tell us their story in a way that makes them feel safe and secure and heard? I think that this information is so important to anyone who practices in the field of sexual health, even if you don't necessarily see a lot of folks with pelvic pain. The tools and the resources that we're going to talk about are also applicable to other areas of sexual health concerns. Number two, the more that we talk about pelvic pain, um, the more we create validation and normalization around it, such that clients hopefully aren't having to see 5 to 10 professionals before they get, validated and before they get an appropriate diagnosis and treatment.
Thanks for watching our video with Cassandra. Do us a favor, share this with someone who might benefit from this information. Your support helps us reach more people with important sexual health information. If you're passionate about this space, we know you'll enjoy these videos, so check them out. Please like this video, subscribe to our channel, and remember, you are exceptional.